Thank you very much, Madam Chair. Distinguished representatives of the government of Turkey and the Turkish Green Crescent Society, dear colleagues, ladies and gentlemen. Let me start with the words of appreciation and gratitude to the Turkish Green Crescent Society for organizing the International Symposium on Drug Policy and Public Health, which is co-sponsored by the World Health Organization. The title of the symposium is self-explanatory. It is about public health approaches to the problem of drug use and drug use disorders, and the essential rationale for drug policies at all levels, protection of public health. This is evidenced by the opening statements of in the preambles of the conventions, main drug conventions on narcotic drugs and psychotropic substances, which literally say, concerned with the health and the parties, which is member states, governments, concerned with the health and welfare of mankind in 61 Convention, being concerned with the health and welfare of mankind, noting with concern the public health and social problems resulting from the abuse of certain psychotropic substances in 71 Convention. So the protection of public health is the main rationale for drug conventions. And indeed, in the world, the disease burden attributable to use of illicit drugs is substantial. And illicit drug use among the top 20 risk factors to health, according to the latest available results of comparative risk assessment of different factors influencing health status. But the disease burden attributable to all psychoactive substances, not only illicit drugs, but also alcohol and tobacco, by far exceeds the disease burden attributable to any other risk factor. Alcohol and tobacco takes the largest proportion of this burden because they are definitely much more common, their use in the populations, which is reflected in this slide, which shows roughly the proportions of people of the total adult population which used different psychoactive substances in the last 12 months. Definitely these differences in the prevalence use are translated into the differences of the impact on health of the populations. If we look at the latest, best available data, which show the comparisons, which show the trends in the impact of different risk factors on health globally, and this data is available from 1990 and 2010, for 1990 and 2010, we can see the changes in the relative importance of different risk factors for global health. When the tobacco and alcohol are moving slightly upward in terms of their relative importance, and the steepest increase in the importance of risk factors are concerning illicit drugs, which goes from 25th position in 1990 to 19th position to become one of the top 20 risk factors for health in the estimates for 2010. Unfortunately, these astonishing figures are not always reflected in prioritization of prevention and treatment programs implemented in countries, municipalities, communities, and at the international level. In spite of the fact, which illustrated on this slide, that the impact of drug use disorders, as well as the drug use on health, are the biggest at the youngest age groups. In this case, from 15 to 29 years old. This is the group which bears the largest portion of the burden which is caused by illicit drug use. And this age group is the key for sustainable development in any country. Let me briefly introduce the most important milestones in the international policy debates, which did happen in the last 20 years and what we'll expect to happen in the next few years. In 1998, the highest level of deliberations at the UN system, the United Nations General Assembly considered the problem, the world drug problem, and adopted the political declaration, which paved the way in 2009 to the Plan of Action, reinforced political declaration, and international plan of action to an international cooperation towards an integrated and balanced strategy to counter the world drug problem. I want to emphasize the phrasing, the language, which was very carefully negotiated by member states, which reflects the integrated and balanced strategy, which already had a lot of emphasis on the protection of health as in the spirit of the conventions. However, in 2014, this year, there was a high-level segment of Commission narcotic drugs, which made, when member states, when the governments of the countries made a review of the progress achieved in implementation of this political declaration. The message from this high-level review is clear. Public health should be in the center of the efforts to counter the world drug problem and should be prioritized in implementation of the political declaration and of the implementation of drug conventions. The ministerial statement in this process leads to another important milestone in 2016, when the United Nations General Assembly will again consider the situation with the world drug problem and will provide guidance on further international action to reduce the social and health consequences of drug use. Let me give some citations from the outcome document, from the joint ministerial statement, which was one of the key outcomes of the high-level review done in this March by governments of the countries of the implementation of political declaration. The joint statement called for continued cooperation between member states, the International Narcotic Controls Board and the World Health Organization to ensure the adequate availability of narcotic drugs and psychotropic substances under international control for medical and scientific purposes, while concurrently preventing their diversion into illicit channels. This is one of the key objectives of the drug policy frameworks. On one hand, to prevent abuse, the drug and illicit or non-medical use of substances, but on the other hand, to make sure that these substances, psychotropic drugs and narcotic drugs, are available for medical and scientific purposes. The joint ministerial statement considered to further promote and strengthen effective national drug control strategies based on scientific evidence, with components for drug demand reduction that include primary prevention, early intervention, treatment, care, rehabilitation, recovery, and social reintegration, as well as measures aimed at minimizing the public health and social consequences of drug use. And the joint statement reaffirmed the need to strengthen public health systems, particularly in the areas of prevention, treatment, and rehabilitation, as part of a comprehensive and balanced approach to demand reduction based on the scientific evidence. Let me briefly provide you with some key figures and also some of the key activities of the World Health Organization addressing these key points in international policy frameworks. One of them is the access to controlled medicines for medical use. And the astonishing figure that in the world, according to the WHO estimates, 5.5 billion people, or 83% of the world population, live in countries with a low or practically non-existent access to controlled medicines for pain management. And ensuring this access is one of the priorities for healthcare systems. According to the UN estimates, more than 200,000 cases of HIV each year, new cases of HIV every year, is attributed to injection drug use. Even more cases of hepatitis B and C are associated with injection drug use. So the WHO, together with UNODC and UNAIDS, developed a comprehensive package of interventions for the HIV prevention, treatment and care among injecting drug users, which combines the key harm reduction interventions as well as some recommendations for policies, supporting policies. It's not only needle and syringe programs and provision of opioid substitution treatment for opioid dependence, but also ensuring enabling environment to address structural barriers for implementation of effective interventions, including the changes, if they are necessary, in legislation, including political and financial commitment to advance these interventions, including considering alternatives to punishment for drug use and addressing stigma and discrimination. It is scandalous when people don't have equal access to health care based on their disease conditions. And this, unfortunately, what is happening in many countries still, when people with drug use disorders are deprived of the right to receive treatment and care for any other medical conditions, or which have no opportunity to be treated and cared for because they have substance use disorders or drug use disorders. The World Health Organization provides a normative guidance. As one of our key functions is to provide normative guidance and technical tools on drug demand and harm reduction, and these are just the covers of many documents which were produced by the World Health Organization, including two recent ones is on identification management of substance use and substance use disorders in pregnancy, and the community-based management of opioid overdose, which still takes more than 80,000 years every year in the world. Let me, when we are speaking about the importance of drug use for health, the other side of that, but what are the resources? What are the societal responses to this problem? Exactly for mapping these responses in the World Health Organization conducted this survey on prevention and treatment resources for substance use disorders. And now we have preliminary results from more than 100 countries, which cover more than 60% of the world population. And let me share with you some of these preliminary results. This is what we clearly see from the countries which submitted this data, that governmental sector not only continues to be the main provider of services for substance use disorders, but also this sector continues, governmental sector continues to be the main funding source for treatment of alcohol and drug use disorders, irrespective what sector, non-governmental organizations or public health sector are responsible for actual provision of services. What we also see is that alcohol, cannabis continue to be the main drugs which are responsible for contacts with healthcare services in most of the countries of the world. And this has significant implications for tailoring the education, training of health professionals as well as the services to the needs. What we also see from this survey is that in most of the jurisdictions, there is a trend for increase, or at least keeping stable, the allocation of financial resources for prevention and treatment of substance, both alcohol and drug use disorders. However, what is alarming is that a significant number of jurisdictions report decrease in allocation of resources available for this area. Of course, it's competing with other priorities in healthcare, but unfortunately, we don't have any information from the jurisdictions that the problems associated with alcohol, drug, and tobacco use are actually diminishing if to take all these substances together. One of the key messages from the World Health Organization is that everybody in all countries, in all health systems, the ultimate objective is to ensure universal health coverage for people who are in need of treatment services. It has three major dimensions. The number, the amount of services available should match the need for these services in populations. The costs that these services imply for provision of this treatment should be affordable to people, and this means that public health should take the major responsibility for treatment of some disorders, and in this case for alcohol and drug use disorders, because these are often socially most deprived population and really needs protection and help from the governments. It's not only about the amount of treatment, it's also about the quality of treatment. And what we see from this survey is, unfortunately, in a significant still number of jurisdictions, there is no legal protection of confidentiality of medical records when it comes to alcohol and drug use disorders, which is definitely one of the significant barriers for any meaningful interaction between healthcare providers and patients. One of the objectives of our joint program with UNODC is exactly to look at the structural barriers for provision of effective treatment for drug use disorders. And we are happy that this year we are already operational in 15 countries around the world, and we believe that this interaction and collaboration between UNODC and WHO is what is needed to change the situation with treatment of drug use disorders in many countries, and make structural changes in legislation and policies that will be public health oriented and will bring public health benefits to the health system and populations. And let me finish with the several key components in the World Health Organization as our contribution to the implementation of political declaration and plan of action. Its promotion and support of implementation and evaluation, and let me emphasize that evaluation of public health oriented policies aimed at reducing drug related harm. It's improving quality, coverage and quality of evidence-based programs, prevention and treatment programs of drug use disorders and associated health conditions. It's ensuring access to controlled medicines for medical and scientific purposes. It's strengthening WHO review process of psychoactive substances for international control, which is our obligation under conventions. And finally, developing and strengthening public health-oriented surveillance and monitoring systems for drug use disorders and resources for prevention and treatment of substance use disorders. Thank you very much for your attention.